As I'm making my way to the ambulance with the patient, I'll take my patient's history. I will ask my patient if they're able to respond or the historian. When did it start, and was it sudden or over time? What they were doing that brought it on, and what makes it better or worse. I ask them to describe the pain, any changes since it started. I'll have my patient point to the area that hurts and find out if it moves or radiates anywhere elsewhere. I'll have them rate their pain on a scale of 1 to 10, 10 being like having a bear tear off your arm. I will ask if the pain is constant or does it change, and if they have taken anything for the pain or illness. If so, how much and when. And I'll ask for anything else that's pertinent. I'll continue my questioning for some past medical history that hasn't already been answered, any signs and symptoms that I don't already know. What are they allergic to? Any foods, medicines, or anything else? What types of medicine are they currently taking for other conditions? And is it right? And when did they last take it? I'll ask what kinds of previous surgeries they had, or if they had any similar episodes. If so, I'll have them describe the last time it happened and what was done to help. When was the last time they ate or drank? I'll ask for any habits they have, like drugs, alcohol, or tobacco, any environmental effects on the patient or risk factors that I need to know about. As I'm with the patient in the back of the ambulance, I will continue my secondary assessment with checking over the brain, lungs, and heart. And if I know the area affected, I can focus on that area. I will continue with checking my patient for any discharge like halos or blood from the eyes, nose, and throat. Then I'll check my patient for JVD and make sure the trachea is midline. I'll go through my C-spine assessment to make sure the C-spine isn't compromised or see if there is any evidence of suspicion. If I find any, I will immobilize the C-spine. Next, I will listen to their anterior chest walls for lung sounds going from right, left, upper lobes to mid lobes to lower lobes, comparing both sides, and listening for any abnormal sounds like rhonchi, wheezes, crackles, or even absent or diminished lung sounds. If I can't make it out with any clear lung sounds, I will listen to the posterior for clear lung sounds in the same method. Moving around the lower left lobe, I will continue with my heart sounds at the fifth intercostal space, mid-clavicular line. Move to fifth intercostal space, left sternum bordered, which is S1, and then listen at second intercostal space, right sternum border, which is S2. Listen for the lovey-dubs. Next, I will assess my patient's hands, check PMS and capillary refills, and continue downward to their feet for the same thing, PMS and capillary refills. And as I move back up, I will look at their ankles and lower extremities for any edema, and continue upwards, check for any abnormalities. Then to the pelvis, I'm checking for stableness and tenderness, along with checking the abdomen for any remarkable findings or any kind of pain. I'll make sure there is no deformities or abnormalities or skin issues elsewhere that hasn't already been assessed. And finally, we'll assess the patient's cranial nerves for any deficiencies. Next, I will continue by getting a set of vital signs, checking my patient for any changes in level of consciousness, skin, eyes, breathing, and respiration rate, looking at rhythm and quality. I will place my patient on pulse oximetry for O2 saturation and heart rate. Next, I'll take a BP of my patient, and then I'll take my patient's temperature, glucose, obtain a SO2 as needed, as well as place my patient on a 4 lead or 12 lead. Taking everything from the assessment and secondary assessment, I have my field impression of what I think is wrong with my patient, in which I can formulate how I'm going to treat the patient, gather everything I need, and perform necessary interventions to help my patient. Finally, depending on what my patient's condition is and what the vitals are, I'll make a transport decision and priority. Then my reassessment starts.